How to cope with the increasing availability of drugs in the EU. In recent years, the European drugs market has been constantly evolving, influenced by a wide range of factors such as the globalization of drug production, the expansion of distribution networks, increased consumer demand with drugs becoming more affordable. Illicit substances are infiltrating our societies and posing risks to public health. This increase in the distribution and consumption of illicit drugs with its criminal networks and public health risks represents a threat to the democracies of the EU.
87.4 million adults in the EU have used illicit drugs at least once in their lives. According to the European Drug Reports 2023 published in mid-June, availability remains high in the EU across all types of substance. Today's market is characterized by a relatively high availability of a wide range of drugs, including new substances for which both consumers and scientists have little information on the health risks.
These drugs are everywhere. Everything can be used as a drug today, and everyone can be confronted, either directly or indirectly, to any addictive behavior, but what is also new, to the consequences of drug-related violence. All member states are facing the problem.
The misuse of drugs can lead to physical and mental health conditions, social problems, and strain on healthcare systems. According to the same report, the mortality rate due to overdoses in the European Union in 2021 estimated at 18.3 deaths per million population aged 15 to 64. The situation has become even worse since the emergence of the online drug markets. The Internet provides consumers with access to a vast array of illicit substances. The sale of drugs via the darknet is a growing concern, posing unique challenges for law enforcement. According to the Europol chief Catherine de Boll, Europe had replaced the United States as the primary target market for international drug traffickers. She warned that with the increase in production, the bloc will experience even higher increase in drugs over the next 2 years. The member states in the Council have adopted EU drug strategy and actions plan for the period of 2021 to 2025, with 3 main goals: reducing the demand for drugs, reducing the supply of drugs, and combating drug-related harm. In addition, new legislation published on June 30 grants Europe stronger powers to tackle current and future drug problems. In a year's time, EMCDDA will become the European Union Drugs Agency, or EUDA, an agency that will be better equipped to tackle drug-related problems.